Hi everybody, this is Dr. Andy Barnett coming to you live from our GoHealth Urgent Care Clinic in Cascade Park, Washington. I wanted to talk to you a little bit today about seasonal affective disorder, or SAD as some people know it. Seasonal affective disorder is something that's otherwise known as the winter blues. By way of introduction, who am I and what am I doing here talking about it? I'm the medical director for Legacy GoHealth Urgent Care. We have a series of clinics, 18 of them currently in the Washington and Vancouver area, as well as Portland, Oregon, and we have additional clinics through other joint venture partnerships in the San Francisco Bay Area as Dignity GoHealth, in the New York metropolitan area as Northwell GoHealth, and in the Connecticut area known as Hartford Health GoHealth. So I'm here today in one of our clinics in Vancouver, Washington, and we'll tell you more about seasonal affective disorder. Thanks for watching. Seasonal affective disorder is known to most people as the winter blues. Interestingly, you can also have seasonal affective disorder that can occur in the springtime. It's still seasonal affective disorder, and in many ways it comes out in people as kind of the opposite of the winter blues. The winter blues look more like typical depression. So the symptoms that might come along with it are those that might make somebody look sad or down, low energy. In particular, there's other symptoms that you might notice if you suffer from seasonal affective disorder in the fall. Those include increased sleep, decreased interest in the activities that you would normally take part in, decreased energy levels all day. The concentration level for a lot of people will suffer, so you have a harder time concentrating. Appetite can decrease or increase in the fall season, and correspondingly people can observe weight changes that were not intended. And then finally, in the most severe cases, because in a lot of ways seasonal affective disorder can mimic depression, it can lead to much more severe symptoms, sometimes even feelings of suicide or self-harm. I'm just going to stop for a moment and say that for anybody who identifies with that or feels that they may have suicidal feelings, whether they think it's from seasonal affective disorder or more routine depression, it's really, really important that you get in and talk with a healthcare provider right away. And if you don't feel safe, go to the emergency room to talk about it with a qualified healthcare provider. Moving away from that a little bit, people say, well, what's the difference between fall and spring seasonal affective disorder? Well, in spring, it's kind of the opposite, where people will have increased energy levels. They actually find that they have a hard time sleeping, even if they're fatigued in the evening. Sometimes they feel that their appetite really increases and they're gaining weight at that time as well. So coming back to what we're talking about today, this fall-based seasonal affective disorder, scientists think that this is probably related to decreasing light exposure, and it's probably the light that's hitting our eyelids and the backs of our retinas. It affects the way that our body thinks that the season is changing, and therefore we have a lot of effects in the way that we feel and in the way that we think during those fall and going into the winter months. For those people who are unfortunate enough to suffer from seasonal affective disorder, they may notice the first symptoms as soon as we get into the fall months and the days become shorter than the nights, and it can continue all the way through the winter time. So this can be a long slog to get through a winter if you're suffering from seasonal affective disorder. If you do have some of the symptoms that I listed, remember those are changes in sleep, interest levels, energy levels, concentration, appetite, weight, or any thoughts of self-harm. It's really important that you get in and talk to a healthcare professional to understand better what really is going on with you, whether there's any testing that's needed, any blood work that's needed, and what treatments might be available to you. And of course, that's always everybody's next question is, if I have seasonal affective disorder, what can I do about it? Can I prevent it in some way, or if I have it, can I treat it in some way? And that's a really good question. First of all, to try and reduce the likelihood of seasonal affective disorder, it's important to take good care of yourself during the winter months. That means the usual good advice that you've always gotten from your mom probably, or your grandma, about getting a good night's sleep, staying well hydrated, and getting exercise. Let me be a little bit more specific. That good night's sleep is really about regular sleep timing. It's not necessarily how many hours a night you sleep. Some people do great with 6 hours a night of sleep. I wish I was one of those. More people do better with about 8 hours of sleep, and I know that I fall into that category. It's more about getting to bed at the same time every night and getting out of bed at the same time every morning. That will allow your body to overcome some of the effects of the changing light that you're exposing yourself to during the day. I talked a little bit about exercise. It's really important to stay on a regular exercise regimen throughout those winter months, and especially, if possible, to do your exercise outside. And I know I live here in Portland, it'll be raining for the next 6 months, but that doesn't mean that you can't get outside and exercise. It's a little bit about the fresh air and not breathing so much indoor recycled air. It's also about getting that increased light exposure. During these months, the more light you can expose yourself to, the better you will do through the winter months at fighting off those winter blues. So when you have the opportunity to do your exercise outside, certainly recommend it. But if that's not possible, indoor exercise is a good idea too. Talking about light exposure, I've had some other pieces in the past where I've talked about the benefits of vitamin D. The light exposure is not just about generating vitamin D. It's also about some important pathways in our brains that are affected by the light that our eyes are exposed to. On the vitamin D topic, it is recommended that if you live north of about Southern California, so the vast majority of the United States, there won't be enough light exposure to form the vitamin D that your body needs in the winter months. So you're either going to have to rely on your stores of vitamin D from earlier in the year, or most medical experts recommend that you take a vitamin D supplement throughout the winter months. Anywhere from about 600 to 1,000 international units daily is completely safe, will not cause any overdoses in anyone. If you're taking that much and still feel that you're not getting enough vitamin D, it becomes important to talk to a healthcare professional about getting your vitamin D levels tested and maybe taking a higher level of supplementation. Finally, I want to talk a little bit about electronics. There is a lot out there in the media right now about what impact electronics have on our sleep and circadian rhythms, and so I'm just going to give you a good general piece of advice, and that is no electronics in bed at night. So when you get into your bed to go to sleep at night, don't have your phone with you looking at it. If you have a reading device of some kind, make sure it's not backlit in any way. Certainly try to avoid things like watching television. But that exposure to the light created by electronics at night when you're trying to go to bed is almost certain to have negative impacts on your sleep patterns. So just get those electronics out. You can have a light on at the side of your bed, read an old-fashioned paper book in the winter. It's definitely more how we were designed to function, and you will probably notice some beneficial impacts on your sleep throughout the winter months. And then finishing up on the topic of light exposure, there are some really great devices out there that are called dawn stimulating lamps. Again, this is about trying to normalize your circadian rhythms at a time when the outside light is not really cooperating. Dawn stimulating lamps can be purchased really in any electronics store. You can buy them online. They're pretty inexpensive, $25 to $50. You can get a decent one. They typically go on your bedside table, and it's used to awaken you in the morning as an alarm clock with a gradual increase in light. Your eyes and your retinas will be exposed to that increasing light, and your body will be better able to deal with the low light levels that we typically see in the mornings when we're trying to get out of bed in the winter. And you'll probably find that you have a lot more energy in the mornings and throughout the winter months. So just a suggestion. There's no particular product that I recommend, but you might want to think about getting one of those if you find that you are susceptible to seasonal affective disorder. That's all I've got for you today. Really appreciate you taking the time to listen. Try and stay healthy over these winter months. Lots of hand washing. Get your flu shot. And if you need anything from us, please come see us at any GoHealth Urgent Care clinic, Legacy GoHealth Urgent Care here in the Portland area, or any of our other partners around the country. Stay healthy, and we'll see you around.